Hey guys, okay, I'm finally making an update video. I can't really remember for sure how long ago I made my last update video, but I did see my orthodontist yesterday. So yeah, I had another appointment. Actually, I didn't see my orthodontist. There's like a new orthodontist who works at the same clinic, I guess now. So I saw her, and she's seen me before. Like, my orthodontist wanted her to see my case just because I'm a jaw surgery case and it's such a big change from my old bite and everything. So he showed her last time I was in, and this time she was in, and she came and she checked everything out. My bite's pretty good, which is pretty amazing. I can't wait to be able to whiten my teeth again, though. They haven't discolored like as much as I thought that they would, being back in braces and having to, I don't know, just go through all of this and not being able to whiten them or anything. But they're not as bad as I thought they would get. But I do majorly want to whiten them because they just don't look the same as they did before surgery. Otherwise, I haven't really been updating very often on my blog or on my YouTube because I've been so busy with school that I haven't had time to really think about it. Like, I wish I had more time. It's just, it's exhausting. I finished my last term maybe like a week ago, or maybe a week or two ago, and I'm starting my summer term next week, and I have an exam for my last term that I still have to write, so I have a lot of work. I just picked up my books today, so I've just been studying away. But yeah, it's been tough because I haven't really had a lot of time to focus on updating my blog or posting new photos or anything like that, which I should, because I think I look way more normal than I did back when I had time to post videos and stuff because I was off, but I was so swollen. One thing that I do notice is this side, like I keep saying, is poofy, because that is the side that I had that horrible infection that resulted in me having to have another surgery, and I guess it's just scarred, and it'll take a while to go back to normal, because this side feels pretty flat compared to this side. It feels pretty poofy. As you guys know, like when I had the jaw surgery, and almost maybe like a week or two after, I started to not feel so great, and I started to swell up, and I had the infection in the left cheek, so I was on antibiotics for like, I don't know, 4 times maybe, and then it got to a point where it was so bad, maybe around 3 months post-op, that my surgeon wanted to, he thought that there was definitely something going on inside, and he wanted to do surgery to clear out whatever was causing this infection. And it turns out that there was something in there. I don't know if it was, I think it was bone fragment. It might have been in my sinus, it might have been in my sinus, because they went up through the incisions here and they cut through. So I think it was in my sinus, because I had like this horrible, it was almost like a really bad sinus infection from right after surgery, and I could taste this disgusting infection like down my throat. Pookie! Sorry. And now that horrible taste is like gone ever since that surgery. So they cleared out that whole cheek, and they had to have a drainage tube. It was draining pretty much from after the first surgery, because this infection was just constantly draining through my incision line. Like, I had a hole in my incision I couldn't heal over because it kept filling up with infection. So I had the drainage tube, and now it's just really, I guess, scarred. So it'll take a while for that to go back to normal, from what I think, just because I can feel the difference between these two sides. But otherwise, I don't have any pain in that region anymore. My TMJ, though, is on and off. I have to say that it is not as bad as it used to be. I used to have TMJ pain like every day, and now it's mainly at times when I'm really stressed out, or if I go to the orthodontist and they have me open my mouth for too long, that hurts a lot. But otherwise, it's not like a daily thing anymore where I'm struggling and I'm taking painkillers every day for it, which is really good because I was so tired of that. So now it's like maybe once a month I'll go through a really bad TMJ day that just is really, really crappy. but otherwise it's not bad. It's actually been pretty good. Just trying to think of what else. I don't know, like, now that I'm coming so close to being done with jaw surgery, there's not a whole lot that I can really talk about. My bite is really good, which is good. There's no sign of relapse right now. I need to go see my speech therapist, but I've just been so overwhelmed with work and stuff that I haven't been able to make an effort to go do that, which I need to do soon. I haven't really had time to do much of anything. I've just been studying and stuff like that, and I'm just, I don't know, it's tiring, but I have to, now that I'm out of surgery and I'm back in school, I have to, like, try to catch up, because I had to miss school to go through the surgery and everything like that, which I'm glad I did because of my complications. It was really hard for me, just to recover, and then even when I went back to school, I was still dealing with complications, and that was really tough because I took on a full course load not knowing that I was going to have this horrible infection reappear and then have to have surgery again, which was really hard, and it made it really hard to stay on top of everything when I had to go through all that stuff again. I was back on heavy painkillers, and I had that drainage tube, and it was just really gross. But now I'm pretty happy with everything, and I have to say that it's definitely worth it. At this point, I can say that, now that everything's done. I also notice just my features look more normal now. Like, my nose isn't as wide as it was post-op. It is wider than it used to be, because in old pictures my nose looks ridiculously narrow, and now it actually is a little bit wider on the bottom than the whole bridge. So it's pretty good, and it's upturned a little bit compared to how it used to be, and the dorsal hump is not as bad anymore because of the jaw moving forward. So I'm really happy with that. I'm so happy. I can't tell you how happy I am that I have a chin, even though I have no feeling in it. I am so happy. It's just like I close my mouth and my chin is still there. I used to close them with, like, I can't even fake it now because the bones are totally different. But it used to, like, curve back. I used to look like I had just a really weird chin. It would make it look really big or, like, long. And now it's just normal, and it doesn't change shape however I move my face, which is normal. So I'm really happy with that. But otherwise, I think I'm almost, actually, I think, what day is it? 2 days away from being 7 months post-op, I think. Yeah, 7 months post-op. So the time goes by, like, somehow it manages to go by, which is crazy, because when you come out of jaw surgery, it feels like an eternity, that you're never going to get to the point where you're just feeling normal again, and you can talk normally, and your face moves normally, and all of that stuff. So it feels really good to be at this point and to have a normal bite and to be adapted to the changes, because that is a big thing that you can't really prepare yourself for, because you don't know what you're going to be like coming out of surgery. Because some people don't look that different. Some people have drastic changes in their appearance due to jaw surgery. So for me, I think it's like so-so. There are parts of my face that look really different. So it took me a while to adapt to that. Like, initially, I was crying my eyes out because I just missed the way I used to look, because it was just my automatic response to going through something so invasive and just not recognizing myself. But now I'm really happy with everything now that I've had time to adapt. And when I look at old pictures, it's kind of weird for me to see my facial issues, and I don't really have them anymore. So it's good. It's good that I don't have to think about jaw surgery day to day, which is something that it just took over my life. I was thinking about it all the time, and now it's just, it's not a big issue. I've kind of haven't really been all panicked about when the braces come off or any of that stuff. I'm just happy that I got through the surgery and that everything is fine now, and that's the most important part. I will, Pookie! Sorry. Puka! Pookie! He doesn't even listen to me. My dog doesn't listen to me. But yeah, I don't know. There's really much more. I don't want to ramble too much. But I don't know, my videos have I'm kind of limited now to what to say, because all my issues are kind of resolved. I still have to deal with the tongue thrusting issue, which I'm trying really hard not to do, but it is so subconscious that I do sometimes I don't even realize it. Other than that, yeah, I don't know. It's weird. Like, you go through surgery and then life goes back to normal, and it's like nothing ever happened and nothing ever changed. And that's kind of how I feel right now. Like, I just feel normal. I just feel like, I don't know, like all my stress over jaw surgery is gone, and now it's replaced with all my stress over school and stuff like that. So it's definitely a change, and it's taken a while to adapt, and it's been bittersweet because it's hard to emotionally deal with everything, but I'm really happy with it. I think the emotional aspects are actually harder to deal with than some of the physical aspects and the pain and stuff like that. It's just hard to know what to expect and how to react to it. But yeah, I wanted to make an update just so you guys know that where I'm at and I'm doing good. I still have to talk to my surgeon. I go in a few weeks to see him, so I have to talk to him about gum grafting on the bottom gums. I'm not going to show you right now because, I don't know, it's kind of gross, but my lower gums have receded massively since this whole process. They were nowhere near as bad as they are prior to jaw surgery and having braces. But I guess just because of all of the trauma and everything that I went through, my gums have receded a lot on the bottom. So I want to make sure that I don't lose any teeth. So I'm probably going to have to go through with gum grafting surgery one of these days. Now that everything's healed and stuff. So we'll see. I'll talk to him next time I go in and see what he says. And other than that, like, I don't really know. I have one tooth that looks a little bit dark, so I'm hoping that it wasn't damaged and there's nothing funny going on with it. It's kind of hard to tell with braces and everything on, so we'll see what happens when the braces come off and see what the teeth are like. So I'm hoping it's fine. I have some teeth on this side hitting the brackets, so my bite isn't true to where it will be after surgery, because once the brackets are gone, it'll sit a little bit differently, which is good. So it should sit a little deeper, probably. But yeah, that's about it. I will try to update soon. I don't know how much is really going to change, but I'll try to make an update when I can. Okay. And yeah, you can message me on my blog or wherever. My blog has like a lot of links to different ways to contact me. So if you go to my blog, which I always post in the information section, then there's ways to contact me if you want to ask me anything about jaw surgery or relate or whatever you feel like. And also I try to post pictures on there, so I have before, after, and between pictures, just in case you want to see what I used to look like before. Actually, maybe I should show you guys my profile because I haven't done that in a while. Just show. I have a chin and a jawline. That's cool. Okay, anyway, I'll update later. Bye, guys.